Diabetic nephropathy. Diabetic nephropathy is damage to your kidneys caused by diabetes. In severe cases it can lead to kidney failure. But not everyone with diabetes has kidney damage. Stage 1 is characterized by early hyperfunction and hypertrophy. These changes are found at diagnosis, before insulin treatment. Increased urinary albumin excretion, aggravated during physical exercise, is also a characteristic finding. Changes are at least partly reversible by insulin treatment. Stage 2 develops silently over many years and is characterized by morphologic lesions without signs of clinical disease. However, kidney function tests and morphometry on biopsy specimens reveal changes. The function is characterized by increased GFR. During good diabetes control, albumin excretion is normal. However, physical exercise unmasks changes in albuminuria not demonstrable in the resting situation. During poor diabetes control, albumin excretion goes up both at rest and during exercise. A number of patients continue in stage 2 throughout their lives. Stage 3, incipient diabetic nephropathy, is the forerunner of overt diabetic nephropathy. Its main manifestation is abnormally elevated urinary albumin excretion, as measured by radioimmunoassay. A level higher than the values found in normal subjects but lower than in clinical disease is the main characteristic of this stage, which appeared to be between 15 and 300 micrograms per minute in the baseline situation. A slow, gradual increase over the years is a prominent feature in this very decisive phase of renal disease in diabetes when blood pressure is rising. The increased rate in albumin excretion is higher in patients with increased blood pressure. GFR is still supranormal and antihypertensive treatment in this phase is under investigation, using the physical exercise test. Stage 4 is overt diabetic nephropathy, the classic entity characterized by persistent proteinuria, half a gram/24 hours. When the associated high blood pressure is left untreated, renal function, GFR, declines, the mean fall rate being around 1 milliliter per minute/mO. Long-term antihypertensive treatment reduces the fall rate by about 60% and thus postpones uremia considerably. Stage 5 is end-stage renal failure with uremia due to diabetic nephropathy. As many as 25% of the population presently entering the end-stage renal failure programs in the United States are diabetic. Diabetic nephropathy and diabetic vasculopathy constitute a major medical problem in society today. Signs and symptoms. Early signs and symptoms of kidney disease in patients with diabetes are typically unusual. However, a vast array of signs and symptoms listed below may manifest when kidney disease has progressed. 4. Albumin or protein in the urine. High blood pressure. Ankle and leg swelling, leg cramps. Going to the bathroom more often at night. High levels of blood urea nitrogen, BUN, and serum creatinine. Less need for insulin or antidiabetic medications. Morning sickness, nausea, and vomiting. Weakness, paleness, and anemia. Itching. The differential diagnosis of diabetic nephropathy is vast, but it includes the following in a patient with known diabetes mellitus. Primary or secondary glomerular disease. Nephrosclerosis. Renovascular hypertension. Renal artery stenosis. Renal vein thrombosis. Multiple myeloma. Cholesterol embolization. Chronic obstruction. Interstitial nephritis. Amyloidosis. Treatment. Control high blood pressure. Manage high blood sugar. Lower high cholesterol. Foster bone health. Control protein in urine.